Good evening. Welcome to our introductory seminar on our new Center for Global Health here at the University of Michigan. My name is Joe Kolars. I'm one of the education deans over in the medical school, and I'll be starting off tonight's seminar. We have almost 200 people enrolled, which I think speaks to the interest across campus in this new seminar or this new center that we're really looking for your advice on. As you'll hear, we've made some steps, but we're most oriented towards building community right now and getting your advice. The way we've structured our discussion this evening is a little bit about the background and the purpose. What are some of the initial steps that we've taken so far to try and shape this new center? But then most importantly is the discussion period, where we're going to have questions and really want to listen carefully to your advice. The way we've structured the discussion is that I'll be leading off with the first part of that agenda. And then I'll be turning it over to John Ayanian, and we'll be bringing in some of the faculty that you see listed here, who will each tell you a little bit about their background and how they've been fitting into the discussions. A little bit about my background. I'm a Senior Associate Dean for Education and Global Initiatives over in the medical school. I've been in charge of our school's global health unit, which is called Global Reach. A lot of my background in global health has been in Asia and Africa. I lived in China for 3 years, setting up a new healthcare system, and I've been part of a number of health initiatives in Africa. First started when I was at the Gates Foundation, and now with my involvement through Fogarty and some of the other organizations. What I'm going to be starting off with is trying to give you a little bit of big context. Global health centers are very common across the country. Most major universities have one. Why is this? I think there's been a big surge of interest, particularly around students. Study abroad programs, going out and being impactful. There's also been tremendous global health funding that has come into the academic sector. There's actually an organization called the Consortium of Universities for Global Health, or CUGH, that's been formed to try and bring together universities who are interested in global health. For those of you who know the global health space, a lot of it is driven by NGOs or non-governmental organizations or big foundations like Gates. But the universities have been trying to figure out how to be more relevant in that space. So I think this movement of consolidation of universities for global health has been really growing over the last 10 years. It should be acknowledged that our University of Michigan had a Center for Global Health that started back in 2009. It lasted about 3 years. The provost at the time came together and said, you know, global health is important. I'm not sure if we need a real new entity here that needs to be at the University of Michigan. I think global health should be living in the schools and the units, and basically that was a short-lived center that was dissolved. It probably had some challenges in terms of how it was designed. It also had some transitions in leadership, but many of us who were around at the time were cheering it on. But the wisdom of the university said, let's hold back for a while. So for the last 10 years, almost, we've been functioning without an actual center that brings us all together, and we've just been cross-collaborating across the schools. It presents a little bit of awkwardness when people are trying to find global health at the University of Michigan. Where does it live? You can get a listing of websites, and so many of our schools and units have major thrust and actual identity in global health. And that's where you find it at the University of Michigan, in the schools and the units. I mentioned before that academia has gotten a lot more interested in global health over the last 10 years. A number of policies and observations have been made about this surge of scholarship and interest in global health. But there's also been a number of cautionary notes that have gone along with that. And I'd just like to acknowledge those out there, because we're trying to do something different and trying to do good without inadvertently contributing to problems. What are some of those problems that at least some of us have seen with global health centers and global health movements across the United States? One of them I would refer to as colonization, academic colonization, where institutions can run in and kind of say, well, this is our country, this is our place, and this is going to be our lab bench. And this is an example of a map that is just showing things that are particular to my school. And you can find different institutions and find that this is where they're centered. And inadvertently, a lot of times, academia or people that come in from high-income countries like ours, they come in and push an agenda. They have a research grant and they're there to collect the samples, to write the papers. And this has been very off-putting, I think, to people who live in low-income settings where they have people like us coming in and telling them what to do or how we can help them without listening deeply. I think it's also generated quite a bit of literature out there in terms of, again, using Africa as an example. It's just one example, but how people going in with aid and good intentions are more often than not creating problems and disturbing the equilibrium, not really listening to the people who are living their lives and have some pretty clear ideas on how we could be helpful if only we would listen in the right way. Some have speculated that this has a basis in some of the foundations of the way many of us were brought up. Many of us were brought up with the golden rule, has some Judeo-Christian origin: do unto others as you would like people to do unto you. So we go around thinking, well, we know what's best. Let me tell you how we do it at University of Michigan, and we bring in our solutions to places. When in reality, we should really be practicing the platinum rule. Treat others like they want to be treated, not how we think we'd like to be treated, and not overlaying that. And at least when I'm working with learners, this is kind of a disruptive thought for them, the golden versus the platinum rule. But it's this whole concept of cultural humility. More than cultural sensitivity, how can we understand other cultures, which we should be always trying to do, but really try to advance the concept that, we don't know everything. We're never going to know everything. Listen first, try and understand, as opposed to layering on our biases, our ways of thinking, our certainty that we have the solutions. So that's been the environment, I think, across the United States as everyone's rushing into global health. We had a center here, then we dissolved it. So why is this being resurrected right now? Well, this is being triggered by a catalytic gift from the Amata family that I'll tell you about. But it's meaningful philanthropy with the promise of more philanthropy with a focus on a new approach. How can academics collaborating across disciplines impact the health of people living in low-income countries? So a focus on impacting the health of people living in low-income countries, not just prioritizing the papers we need to write, the research grants we need to get, but how can we express our work and how people are living differently? How can we establish a new model of collaborating with others and with ourselves? So that was the founding principle on which this new center was created. And just a few words about the donor. Tachi Yamada is a former University of Michigan faculty. He is actually still emeritus faculty with us. But he and his wife were very strongly anchored in the University of Michigan and still have their football tickets, are here 3 or 4 times a year. He's on a number of President Schlissel's boards. But Tachi, after leaving here, went into industry. And then he was president of the for global health for the Melinda Gates Foundation. But he's had a lot of leadership roles in advancing biotech vaccines. He's on multiple global health boards. But we're thrilled. You know, he goes around visiting lots of universities. He's a very popular global health advocate and speaker. He thinks we have the unique set of individuals, properties, and culture here to make a difference. To read a quote from him, as you can see below that picture, I want to see Michigan living up to its potential for transformative impact in global health. My desire is to help propel University of Michigan into global health, much like the Gates family did for the University of Washington. And again, for you global health watchers, as you probably know, boy, what the University of Washington is one of the major public health institutions that have just really been transformative in global health. And this got started even before Bill Gates was in the picture by Bill Gates Sr. Tachi wants to have this kind of impact here. He started with a relatively small gift for him, $10 million that's being matched by the university, so that he can see how we proceed with it, impact in low-income countries, with his intention to give a much larger gift and create a much bigger center here at the University of Michigan. So, so we're off to a start, and we're trying to build community on trying to see how we can make that happen. So this grant was only, or this gift was only signed the end of last year. And John Ayanian is going to kind of walk you through some of the steps and where we've been. But one of the things when we started talking about this and building momentum, we had to come up with a name. And I just would like to take a few moments to explain our name. University of Michigan, first of all, this is intended to involve all 3 of our campuses, all of our schools, to really be a collaborative experience. This is not at all designed or intended to be anchored in just one school or just the medical school and the School of Public Health, but it is really designed to be synergistic across our entire community. Second of all, it's a center. It exists outside the school, and many of you may know there's always this natural tension between what's in a center and what's in a school, but this center is designed to bring schools and faculty together. It's not aimed to compete or replace what's going on in global health in so many of our schools and units. It's designed to add value and to enable a coming together so that we can take the field in a collaborative way, and we aren't overly siloed, which sometimes can happen at a big institution. Global health is always a term that requires some explanation. I found as somebody, a physician coming from the medical school, whenever I say global health, people automatically assume I mean health care. This is taking care of patients. This is health care services. Really, that's a small part of this. We're thinking about health and all the social determinants of health, which all of our schools and faculty can contribute to. It has to do with education, climate. Sometimes the healthcare aspects are the downstream failures of our inability to deal meaningfully with all of the other social determinants of health. So yes, for the faculty who are interested in healthcare components, there will be ones there. But as you see, as we're trying to build community, we're trying to really look holistically at global health. One of the things the Yamadas have charged us with is to start in low-income countries. So most of us know we've got global health here in Michigan. There's global health all over the world by definition. But one of the areas you'll see us focusing our priorities as we try and build our ideas and design, it's in low-income countries. And then finally, equity. John and I have found sometimes when we introduce this term, it often generates questions, which we like that. We like to stay focused on equity and have the chance to explain that. And I often go back to this picture. It may be overused, something you've seen before, but trying to understand the differences between equality and equity. And equity, is particularly in global health, is why are so many health determinants, how you live, how long you're living, dependent on where you were born and the social circumstances you were born into. I think this is something that resonates very well with the University of Michigan's values. So to try and look at equity, sure, there's global health in rich countries, but we're going to be looking at those parts of even rich countries that can be marginalized, and again, to begin more with low-income countries. I'm going to stop there and turn the conversation over to John Ayanian. John, I'll let you introduce yourself and go through these next set of slides.
Thank you, Joe. To all of you on this webinar this evening, welcome. It's great to see. I think we're up to 126 participants, and just a sign of the robust interest in this topic, and we hope your interest and enthusiasm for engaging with the new center. I'm the director of the Institute for Healthcare Policy and Innovation, which is a campus-wide, university-wide institute focused on improving the quality, safety, equity, and affordability of healthcare. And I'm also a professor in internal medicine at the medical school, health management and policy at the School of Public Health, and in public policy at the Gerald Ford School of Public Policy. And I've been collaborating with Joe and other colleagues on the webinar this evening in helping to plan the launch of our new Center for Global Health Equity. And so in this next part of the presentation, I'd like to just walk you through some of the core values that we've been developing in recent months to guide the center, and then some of the ways that we're prioritizing projects, what we've accomplished over the past year, and what sort of services and functions we're hoping to support to engage faculty and learners from across our university and our global partners. So the core values are shown here, and these were developed as part of the listening tour that Joe Kolars and I have made over the past year across the university, meeting with faculty, with deans, with students, as well as guided by a very talented visioning team that through the winter term was helping to think through some of the ways in a very open and transparent way we could develop the center. And so we're very much focused on genuine, respectful collaboration, both within our community here at the University of Michigan, as well as very importantly with our external partners. many of whom are already collaborating with all of you and others at the webinar this evening, as well as new partners that we hope to engage going forward. And as part of that respectful collaboration, cultural humility is essential. Speaking to some of those challenges and limitations that have affected global health efforts in the past that Joe outlined, that, really trying to avoid any sense of a colonial approach to global health equity collaborations, but really a spirit of humility and collective learning and playing to our strengths. We know there's, as Joe mentioned, lots of pre-existing strength within the schools and colleges and the 3 campuses of the University of Michigan. And we want to tap into those strengths and help you to take them in new directions. And we want that to be very intentional. We'll talk about some of the themes that we have been focusing on in the early development of the center, and some of our faculty colleagues speaking in the webinar this evening will talk about how and why our intentions are focused on those themes, and to be transparent in these monthly seminars that we're hosting, this being the first one of the new academic year, is a true effort to be transparent and share and elicit feedback and engagement. So the priorities that we're outlining this evening are very much a work in progress and open to your engagement. And then finally, our donors, Tachi and Leslie Yamada, as well as all the faculty that have engaged to date, really want to focus on impact and having a line of sight and a way of measuring and holding ourselves accountable for whether we truly are having an impact on health equity. And so through this visioning process and the listening tour, we've come to focus on 4 major themes that we think are very inclusive of the wide range of interests and the interdisciplinary opportunities that the center could help to foster. Strengthening systems for health. And very intentionally, we shift the focus there and think about systems broadly. So this is not just healthcare systems, but all the systems within society that influence health, and healthcare being one component of that. We're very much focused on social and environmental determinants of health, broadly defined, and we'll talk some further about some of those issues in our panel discussion with Professor Love. We're very interested in the role of technology and technical solutions. Professor Mukherjee will be talking about the role of data science within the center. And then finally, empowering women and their roles in families, communities, and societies. This is a major theme where we think there's already substantial strength at the University of Michigan that we could help to foster new engagement with our partners around the world. And Professor Rozek will discuss that during our panel. So as we begin to think about operationalizing these themes with guidance from our Leadership Advisory Council and our visioning team, we've started to shape a lens for assessing and prioritizing the wide range of opportunities, because we know we can't do a little bit of everything well. We'll need to focus. And so in this early phase, we're looking for new opportunities that can be reflected in one of the center's 4 emerging themes. As I mentioned, where it has a line of sight to impact and actually improving health and health equity. We're also looking for clever, transformative solutions and innovative work. And in particular, we're hoping that most, if not all, of the projects supported by the center will engage faculty and potentially students from at least 3 University of Michigan schools and units, and play to those strengths that already exist within the schools. We're looking for topics and opportunities that may not be receiving needed attention, and where there's some sense of urgency, where the work of the University of Michigan could make a difference. And then where engaging with our external partners around the world would be supported by the center. This is a slide with a number of time points, but just to give you a sense of how the planning for the center has developed over the past year. The gift that Joe Kolars described from the Yamada family was signed just a little over a year ago at the end of August 2019 and was publicly announced last October. And that really triggered a fairly intense phase of planning and listening and engaging with colleagues across the campus, where we, in December and January, convened a visioning team and a launch advisory committee, both of which represented multiple schools across campus and faculty from different perspectives. We had a student MBA team from the Ross School conduct their winter MAP project, an internal consulting project, where they guided us on benchmarking against other major university global health centers and thinking about how we prioritize opportunities. We have begun a Creating Connections initiative where we are identifying, as I'll mention in a moment, over 900 faculty who are potentially working in the field of global health across the University of Michigan's 3 campuses, and thinking about how we tap into their expertise and categorize it for partnerships. We had hoped to have a major symposium with former President Bill Clinton as the keynote speaker in April this past spring. And we, unfortunately, as many of our activities were affected, we had to postpone that, that seminar, but we hope to have a very public launch seminar potentially in the coming spring of 2021 if we're able to gather in person at that time. And as you'll hear later in this evening's webinar, we've convened multidisciplinary challenge groups on a range of different topics, and we've begun discussions with the Ministry of Health in Rwanda about a potential large-scale collaboration between the university here and the ministry and universities in Rwanda around their systems for health. And now here in September, we're launching our website and our monthly seminar series with this evening's seminar. And just to wrap up some of my remarks in this part of the seminar, this shows that population of 971 faculty who we've identified across our campuses with the breakdown by their primary school, college, or campus affiliation. And you can see that global health is widely represented across our university. Over the course of this fall, we'll be rolling out a survey. We hope to develop a taxonomy and a database, much like the experts database that we've developed for IHPI, to help colleagues find each other within the university and develop new collaborations, as well as help external partners and stakeholders identify people with relevant expertise within our campus community. And then lastly, we've been focusing on some enabling functions and activities. You'll hear about some of them in the thematic challenge groups that we'll be discussing in a moment. Working on external partnerships, data resources and analytics support, project management support for large teams coming together to develop new funding proposals. And we very much want educational and learning programs to be an important part of the center's activities. And we'll look to many of you to help us develop those areas of focus in educational programs, building on existing resources that we have on campus. And then finally, we want to emphasize, as Joe did earlier, that the purpose of the center is not to compete with existing global health activities within the schools and units across campus, and not to rely or share any indirect costs that are already going to the schools, but to bring in new resources to support the center and to have a multiplier effect on those existing activities and in fostering new collaborations. And in no way replacing or diminishing the ongoing work of excellence within our schools and colleges. So with that, I'll turn the presentation back to Joe Kolars.
Thanks, John. Hopefully, as you can see, we've been out in a lot of the schools, talking with a lot of people, trying to listen deeply. And we really want to create functionality within the school or within the center that isn't already going on within the schools, to try and add to the schools. But the big questions that we've been wrestling with is, how should we create community to focus on strategies for impact and the identified themes? Global and health is just about everything. If we do everything, we'll do nothing. We can probably pick a handful of things where we should really come together. And that's what we've been trying to do. We've put some structure in terms of our themes, but how do we get at the big ideas that we should invest in? And especially, how do we turn to the faculty and the grassroots on this, so that we have our faculty listening and working with their partners overseas to kind of inform that. I think many faculty are aware of collaborative approaches across the university that tries to bring us together. Here's a couple of them. There's the grand challenges approach. So some of us have been talking about, should we try and come up with a grand challenge question or set of questions within the themes that we put an RFA out there and try and structure proposals. Should we try and use the M-cube model that many have found useful? Or should we try and learn from some of the other models around campus? One of these that have been really attractive is the Ideas Lab. I think it's an NSF model that the Biosciences Initiative have utilized. And this has attraction to us. Just again, to cite the campus model for this is the Biosciences Initiative decided that the big question that they were going to try and build community around from the different schools was predicting human performance. So the model they used was calling for participants who completed an application and then do a highly selective version of taking 25 experts from different schools and in putting some money out there and saying, here's the money, design a proposal, design an approach. And again, this is a fairly structured process. I think it was a 3-day retreat where very select individuals are invited in to build the idea that would support this. So this is one of several models that we considered in terms of how do we get our faculty and people on the ground to help us construct where we should be thinking about making our investments. What we've decided to do is a little bit of an amalgamation of that and to try and say, why don't we come together with some challenge groups that are made up of collections of faculty, again, from across our university that have some topical areas within the themes that you heard earlier, and see if a faculty can come together and design what's the best way to structure a call for proposals. What's the best way to get our faculty input with their partners on how we should approach our partners and how should we listen to the direction from our partners in low-income countries on how to proceed here. So the next part of this presentation, what we're going to hear from is just what we've got is co-facilitators for each of these groups. And we'd like to attract more people in. We'd like to attract more ideas in terms of how do we design proposals that will be actionable, that will have a line of sight to impact. We also would like your idea on some other challenge groups that might fit within our themes. I've been hearing some dialogue, for example, from our School of Engineering and faculty who are interested in maybe a challenge group on how do you come in, how do you build some of the design functionality into some of the devices and products out there that could really impact global health. But let's start by hearing from a few of the co-facilitators from these groups, again, 3 of them, where you're going to hear, well, what's this about? Who's involved? What have the conversations been like? And again, our whole purpose here is to build community across the university so that we can get the wisdom of our faculty, you know, supported by our learners, by their partners overseas, to try and structure where we should be making our investments. We haven't spent any of that money yet. Where should we spend it? How should we spend it? We're not waiting for an RFA from someone else. We can design that. So let me first turn things over to Bhramar Mukherjee. And Bhramar, if you could introduce yourself, please, and we look forward to your reflections on what's going on in this discussion.
Thank you so much, Joe. And my name is, good afternoon, everyone. My name is Bhramar Mukherjee. I'm a professor and chair of biostatistics at the University of Michigan School of Public Health. I also have some other roles in institutional initiatives related to data science, very closely involved with Michigan Institute of Data Science, or MIDAS, also in charge of cohort development in University of Michigan Precision Health Initiative, Associate Director for Quantitative Data Sciences at the Rozek Cancer Center. And most importantly, I have the honor of directing the Big Data Summer Institute, which brings in about 40 undergraduates from all over the world for 6 weeks in the summer, and who experiment with data and human data related to human health. So data science, next slide, please. Data science and global health are intrinsically related. So it was really a process of building coalescence and galvanizing the community around certain themes. So as a part of the visioning team conversations, we actually saw that there is tremendous interest in using data science for harnessing the information and doing greater good. And harnessing data science for health discovery and innovation has been one of the emerging themes that many people resonated with. I think we have a very strong community in data science at Michigan, and by that I broadly mean many departments and any quantitative work that goes on in School of Engineering, Institute of Social Research, School of Public Health, in the Liberal Arts and Sciences Department, and College of Pharmacy. So data science really touches every department, of course, Michigan Medicine. And then how do we build an intersectional community in data science and global health? So you have heard a lot about me, but the person who has done all of the work is actually my co-conspirator and co-facilitator in this discussion, Professor Akbar Walji, who has been very, very active in the Data and Methods Hub at IHPI, as well as promoting artificial intelligence and machine learning methods in healthcare in the medical school. Akbar is an associate professor at in internal medicine and has been leading most of this work and discussion. So what we have been trying from the visioning team perspective is really to build a community of practice among those who may be interested in this area. So we have been having conversation, as you see, from several different constituencies on campus where data science has a strong presence, but this has been a very iterative process, and would like to be more inclusive going forward, building really this community of people who are interested in data science and as its translation to global health. So in order to coalesce this community around a particular opportunity, we draw our attention to the next bullet point, please. Around this funding opportunity announcement, which the NIH just released in July, in the month of July, with proposals being due in December. And it is a great opportunity because this focuses on exactly this intersectional theme of really harnessing data science for health discovery. And this has a focus on Africa, and it has several opportunities in terms of research excellence, Center for Research Excellence, training programs, and ethical, legal, and social implications of research. So the planning processes for all of these grants are giving us an opportunity to really gather the community around a focused topic, and several people have expressed interest in participating and putting together a very strong competitive proposal for many of these opportunities. So we have focused on this FOA as a primary sort of endpoint right now, an immediate point of discussion, but the conversation and the efforts, my understanding and my hope is that much larger, so that anybody who is interested in this area, whether it is building infrastructure for education and training, or using modeling techniques or predictive models embedded within electronic health records to change practice, we are really trying to build momentum and build ideas and a repertoire of people and a group of people who can nimbly move together and position themselves for these funding opportunities. So I strongly encourage that if you are interested to get engaged in this movement, in this data science revolution, then please reach out to Akbar or myself. So with that, I'd be happy to take other questions to preface our discussions going forward.
Thanks so much, Bhramar. That was perfect. And we're going to have about half of our time for discussion, so maybe we'll hold off for that. I'd also like to just let people know, as our monthly seminars go forward, we're going to be focusing on specific topics. So our seminar for next month is going to be devoted completely to data science and global health. What has this group of faculty been doing? How do we pull in others? How do we connect with learners and our partners overseas? So for an example of another challenge group and how that's been functioning, I'd like to turn things over to Nancy Love. Nancy?
Thanks, Joe. Yes, I'm happy to be here to introduce our Climate Vulnerability and Global Health Challenge group. There have been a number of conversations relating to this group, and it's really looking at the relationship between climate and environment, including multiple facets, including water security. What I mean by that, access, quality, food security defined similarly, related social determinants of health in low-income countries. And as you'll see with these challenge groups, we intersect significantly with each other. So data science, women, and communities come into this in this significant way. So I am Nancy Love, for those who don't know me. I'm in the College of Engineering in the Department of Civil and Environmental Engineering in the Environmental Biotechnology Laboratory. So my own work has included a focus on clean water in Africa, as well as significant efforts and resource limited settings here in the United States associated with water access and water quality. In some of the work I've done, both internationally and domestically, I've worked in partnership with Joe Eisenberg and others at U of M, and Joe is co-facilitating this challenge group with me. He's the chair of epidemiology in the School of Public Health. And he's been active for many, many years, looking at the link between water quality, climate change, and patterns of infectious disease in multiple continents, Africa, South America, Mexico City, Central America. So he's quite experienced in this, and I look forward to working with Joe to facilitate this group. Our challenge group has reached out to a number of schools, institutes, and campuses, as you see on the next bullet here on the slide. Many of these groups have put in quite a bit of effort in kind of visioning and thinking ahead about this particular challenge group area. There have been engagements through several preparatory meetings and a retreat. We're a little further behind the data sciences group, but we're quickly getting there. So what's been the focus of our work? We have an upcoming seminar as well later this fall. It'll be devoted to this topic, but to date, we've focused our conversations on areas we already have partnerships with and expertise. So in addition to some of the water-centered work that I gave you examples of, there are other areas that really overlap with climate and health relating to air quality. So clean energy comes into mind in some of the work that's been done. So we're mindful of kind of branching across these different areas of the environment as they all intersect with health. We've spent time envisioning what transformative impact could look like in local communities. And that's an area where we look forward to more discussions. And we want to consider how to build on models that work and have shown that they have impact. For instance, in places like Nepal, where multi-year longitudinal demographic data have been used and integrated to integrate more closely with environmental factors to better understand and recognize the causal influences on health, along with that data. So taking these long data sets and really making the connection to health. There's a lot of data out there, and sometimes we aren't using it in ways that will help us draw those connections and then get to solutions. So trying to bridge that. And there are opportunities out there, as Bhramar talked about in what's going on with the other group. For example, right now the National Academy of Medicine is looking to strategize on how to work with a team in this specific area that would address climate vulnerability and health. I'd also offer that in my own experiences in working with collaborators in public health and engineering, oftentimes we have a group working on NSF funding and a group working on NIH funding, and there's this imaginary wall that we're not allowed to cross. And that what this center can do is help us bridge that work so that we transform from both sides in a way that we can't do right now with the federal funding. So major efforts on both sides, if we're kind of focused in a common thematic area in both directions, then I think we can have a greater impact by bridging between those two funding agencies. So with that, I'll pass on to the next group.
Great, thank you, Nancy. I know there'll be interest in our discussion period, so thank you. Our last challenge group will be explained by one of the co-facilitators, Laura Rozek. Laura, if you could please introduce yourself, let people know what you do.
Great, thanks. Thanks, Joe, and thanks, John. And it's just been really tremendous being a part of this effort so far. I'm really excited, and especially excited about our challenge group on empowering women and communities in low-income countries. I'm Laura Rozek. I'm an associate professor of environmental health and global public health at the School of Public Health. And I also direct the Center for Southeast Asian Studies at the International Institute. My co-facilitator is Cheryl Moyer. She's an associate professor of obstetrics and gynecology and learning health sciences at Michigan Medicine. One thing we do know is that empowering women is an essential aspect to achieving global health equity. Just one metric is that women comprise at least 70% of the global health workforce, yet they only make up 25% of the global health leadership. And so our theme, our empowering women, is important because we want to challenge women and use them as change agents for better health for themselves, for their families, and their communities. And what our challenge is how to enable this impact through increased empowerment of women in communities and also on a global setting. My global work has been largely in community-based studies in Southeast Asia and in Ethiopia. Cheryl Moyer is focused on social and cultural factors that influence maternal and neonatal health outcomes in sub-Saharan Africa. She's had a large USAID project there addressing maternal health in Ghana. We're both very passionate about training international scholars here at the University of Michigan. I've had scholars in my group from China, Southeast Asia, Africa, Iran, and Colombia. And Cheryl has done training with scholars from Africa, including having a role on Fogarty training program for postdocs from Ghana. And part of what we see as our challenge here is not only research projects, but also incorporating training and really empowering women from these communities. We've been really lucky to have an overwhelming amount of interest, and we've included people so far from the schools of nursing, public health, medicine, social work, and LS&A, and the Institute for Research on Women and Gender. Although I have to say, both Cheryl and I are really seeing this conversation in this seminar as a way to reach out and talk to people and ask people, when you see something come across, as I'll explain in a second, please contact us and please join. There is such a breadth of interest in this topic and expertise across the University of Michigan, and we're really interested in harnessing this. We know this will take a lot of time. We know it'll take a lot of thoughtful work, and we know that time for most people right now is at a premium. However, I know a lot of us have talked to our collaborators and our friends in low-income countries, and COVID-19 is reshaping health systems right now in a very rapid way. And I think we're at a really unparalleled opportunity to really empower women and empower women in their communities to really come up with better health systems and improve health. One way that we've started to do this is to take advantage of our resources at Michigan to set up a series of research jams. We're in the process of setting up dates for those. We're going to coalesce our work and ideas. Also try to figure out thoughtful ways that we can incorporate our partners into the process. Because just as we're busy, our partners in low-income countries are even busier. We want to incorporate them in the conversation in ways that are meaningful and helpful to them primarily. Cheryl and I see again this as an important way to reach out to you. We'll be sending out a series of announcements on joining into these research jams. Please, if you're able to, join the research jam or express your interest so we can continue to incorporate people from across campus into the conversation. We'd love to have you, so please watch for these invitations. As Nancy said, I think the real, for me at least, the real challenge in implementing global health ideas across campus has been funding, has been trying to coalesce and pull together different types of funding. So we see this as a way that we can empower groups to work together and address challenging areas in women and communities. I'm really excited to work with everyone. Thanks.
Great. Thank you, Laura. That was perfect. And again, these are groups where, you know, they're trying to advise us and help us with collaborative decisions on where should we start making investments for impact. We've got $20 million. It's all expendable. This isn't in an endowment. But it's a little bit challenging to try and say, well, where should we put that money to do the most good if we're trying to talk about impact in a way that reflects our scholarship, our values here at the University of Michigan. So I think the quality of these discussions, and as we're building momentum and drawing more people into these discussions, and hopefully building maybe one or two other challenge groups, is really attractive to us. One other aspect that I'd like to mention that's been a part of our conversation, which John mentioned earlier in the discussion, is that we've been having some very high-level discussions with the government of Rwanda. Many of you may know we've had a number of our schools and our faculty involved with initiatives in Ethiopia that have been impactful. Rwanda has approached us saying, boy, we like what you've done in Ethiopia. Can you come and do that in Rwanda? So the president of Rwanda has been involved, and we're talking directly with the Minister of Health about aspects where we may collaborate on system strengthening there. Rwanda is a unique country. They're really increasing the amount of money that they're going to be putting into health. They need a lot of work with the human resources for healthcare workers. But they're very mindful of the social determinants of health and how do you change the whole environment. This is also the only other place that I've heard the term global health in Africa. You know, many of us think of global health as kind of a term we came up with in the North. People don't run around Africa going, and we do global health. But Rwanda has actually come up with a university of global health equity. Started in part by Paul Farmer, Partners in Health, and we've been also involved in collaborating with them. So Rwanda is very much a community of interest for us, and for those of you with interest in that space, know that there are building conversations there. Well, at this point, again, we wanted to share with you where we are in terms of our approach to this opportunity. Hopefully you can realize that this isn't fully developed. We're in relatively early days, but we're trying to create community to inform decisions and approaches. And now what we'd like to do is get some of your input, suggestions, or what kind of questions have we maybe triggered. And for those purposes, we're going to call on Andries Coetzee, who's been in the design room with us from the beginning. but he's also a professor in LSA, and many of you probably know him as director of our African Studies Center. So Andries, thank you for fielding the questions. I know you probably have some of your own, but we'd like to devote maybe the next half hour to discussion and input. So Andries.
Thank you, Joe, for that quick introduction. Let me just say a little bit more about who I am and where I fit into this. So as Joe said, I'm Andries Coetzee. I'm a professor of linguistics in LSA. I'm also the director of the African Studies Center, and I serve as advisor to the provost for Africa engagement. Through the African Studies Center, I've been involved in many projects in Africa. Our function as the center is to kind of coordinate and facilitate all different ways in which Michigan's faculty, students, and staff engage with Africa. And a lot of work that Michigan does in Africa is in the broad domain of public health and health more broadly construed. So I've been thinking about this for several years. And then as Joe also mentioned, I was part of the so-called visioning team that met early on that thought together about how the center might be set up. So I'm happy today to be facilitating the Q&A. We have a good 30 minutes for that. You can use the Q&A function in the lower right-hand side of your screen to type your question. I will be fielding questions there. I might combine some questions, try to make sure that we hit several different themes. So, please go ahead and put your questions there. So we have a question there that is a version of a question that we have heard throughout the planning period. So let me pose that question to the whole group, and probably Joe or John can take the first stab at it. And it is the question about at which stage and in which manner do we involve our global partners? So equity isn't only access to health care, but also participation in the design of the process, participation in deciding what the questions are. And nowhere in our discussion today has it been clear where they get involved. We talk about all the competitions that would be set up for funding. Is there a way for our global partners to participate in that, participate in talking about the center and the kinds of questions we're going to look at?
Great. Maybe I'll take a first pass at that, Andries. I think a lot of our discussions to date have been about how to set up our center structurally within the university, and how do we learn how to collaborate better with ourselves, and how do we express value to the people who are going to be supporting us. So one of the things that the road has been littered in my mind with global health projects that are not sustainable out there, because there's a grant or there's some temporary funding, it runs out and everything dissolves. And so sustainability is important, trying to get buy-in from our universities, trying to have something that doesn't just live grant to grant. So buy-in from the philanthropy community, which I think is going to be a big part of this, has been crucial. To date, we've been bringing in perspectives that each of us have gathered from some of our partners, but we're trying to shape things that we think that will bring value to the university and to what the vision is for our philanthropists. But before we're actually doing anything, all the design and the pursuit of specific questions and opportunities absolutely need to fund to engage our partners. So that we've just taken as a given. And I'm not sure if maybe Bhramar would like to talk about that data science initiative for Africa, for example, and looking at there's been extensive input and direction and actual leadership. We're enabling leadership of partners in Africa, specifically in Kenya and in Ethiopia and some of the surrounding countries. So I think that's just been bedrock, is they are informing us and taking leadership. So I think that's crucial. I don't know, Bhramar or John, would you like to add to that? But it's such a crucial point for us.
Bhramar, please.
So thank you. So I think that I see a couple of questions, and I think the about data science and the vision for data science and related way. So I think that the Data Science for Africa, that initiative, and I tried to paste the link in the chat function for the funding opportunity, but I was just told that the chat function cannot be viewed by listeners. So perhaps Carrie, you can paste it in the Q&A so that everybody can have access to that link. So there has been tremendous interest in all of the three different aspects of the funding opportunity announcement. And I think that identifying the African institutional partnership has been key here, because some of those funding opportunity announcements are led by US institutions, but most of them are actually led by African institutions. And so they have to define the research and define the agenda. And that's sort of related to the question that was asked in the chat, is that big data seems like a very esoteric concept when you don't really, are we talking about small studies and clinical trials and longitudinal studies and cohort studies and panel studies? These are also very relevant. So please do not get us wrong that data science does not really always mean big data. It means principle query so that you can get to the right inference in the knowledge. So a couple of examples, for example, that, I'm involved in a project which is music therapy in Congo. And that's a very small two time point, 3 time point repeated measures study. And we have to, and someone, Dr. Fettes asked me about the mixed methods research. We have to really understand the context. And it is data science is not just big data. It's very well designed, well characterized small studies, which helps you to answer the question. I think that defining the question is the important part. And then also building capacity, training, education, these are all related to that. And in School of Public Health, we have been running this global statistics core, where we have partnership with our international partners, where we go and we teach short courses, but we also spend a lot of time. My colleague Phil Boonstra has taken a lead role in that, as well as my colleague E. Lee, and support from Matt Bolton and the School of Public Health Office of Global Public Health. We have been doing this. So, and then we establish trust, we establish friendship, we understand the partners, and then we actually launch research projects. So data science is quite broad, from small, well-characterized study, from modeling the pandemic in India based on publicly available data, to really get into a healthcare system and try to embed prediction algorithms for having sepsis or having a secondary infection for a hospitalized patient. So it is a whole realm and ensemble of things we are thinking about really for quantitative sciences embedded with problems which are grained in global health. So that would be my sort of take in that. John, I don't know whether you wanted to add.
Can I add something to what Bhramar said? I think that's really critical. I think from my perspective, outside of sitting in engineering and sciences and kind of outside of the core of public health and the medical school, the data science skill set and the training I want to emphasize, there's a huge demand, there's a huge interest in this, especially in statistical training, and it will enhance the research capacity beyond data science. So once you have that, then these areas of what I are co-leading with the climate change and health and the area that Laura's working in, and some of the others that are being envisioned, will be enhanced by that educational element that comes out of the data science challenge group.
Thank you so much, Nancy.
Andries, I might just add, the question, where are the partners, which is where you started. That, as Joe mentioned, that's got to be front and center in all our considerations and planning, and the partners have to be setting the agenda that collaboratively with us. The example that we mentioned about working with the Ministry of Health, as Joe said, there's a case where a potential partner actually came to us from a country in Africa based on a track record that the University of Michigan already had as a strong and collaborative partner in Ethiopia. And so we're trying to build those same principles. The partner is coming with that expectation. They are setting the agenda and trying to determine if we're the right partner for them. And I think, and how we can help them advance the agenda that they're setting for their own country around building their healthcare workforce, but also building the systems that people go into practice. And so there are innovative features of things, expertise that we have here at the University of Michigan that they're very excited about kind of weaving into the agenda that they've already defined for themselves. For example, how do you set up data systems after people finish their training to track the quality of care they're delivering and the outcomes that their patients are experiencing, and sort of moving beyond just counting the number of people we're training, but the impact that those people in their own countries are having on the health outcomes of their communities. So, we're learning as we go, but we're building on a very strong track record that many of us here at the University of Michigan already have as very good collaborative partners.
Joe, I see you have your finger raised.
I just wanted to add to a part of that question is maybe an example. And so for me, listening and learning from the Climate and Health Vulnerability, Climate Vulnerability and Health Group has been fascinating. There's actually quite a bit of data out there in these pockets. And what I've learned is there are these demographic surveillance systems where they're doing these longitudinal studies on communities and health. But Pam Jagger in the School for Environment and Sustainability, Bill Axon over in ISR, what they've taught me is often these data systems aren't correlated with environmental factors. And so that you can't see the relationships between the data on what's going on with health parameters and the environment. And one of the approaches that they would like to try and do is to try and connect that data. So for example, how can you get that data and return it to the community? All right, so there's data monitoring the women who are having miscarriages and stillbirths. What if you linked up that data with the women who are actually using a high degree of indoor cooking and trying to show to the communities, look what happens, and return that data to empower the communities to say, if you want to change this aspect of your health, this might be one behavior to look at. And again, I'm just learning this from my colleagues, but I'm impressed with there is pockets of data that aren't being utilized and are not being put in the hands of the communities who could utilize it.
Sure, Laura.
Well, and not to belabor too much before our next question, but it all circles back to the way, I think the best way that we can work with these communities and work with our partners is to teach them to use these data, to teach them to be empowered by the data, and teach them to translate the data. Bhramar worked with some of my collaborators with her biostatistics training program. And then in the best of all possible cases, they're not only empowered, but they're knowledgeable and they can do this themselves. And we leave. And we are not setting up shop somewhere, as Joe so very well described in the beginning, but actually that we're making it so people can run their own studies, analyze their own data, and be empowered for change.
So clearly, we will not have nearly enough time to get to all the questions. It's great to see that there are this many questions. I'm hoping that we'll be able to save the questions and, if necessary, maybe follow up afterwards, or else, you have emails for Joe and John and all the other people involved in the center. So questions can also be hopefully answered in that way. But let me steer us into another direction and pose a version of a question asked by Cheryl Moyer in the Q&A, but it's also something that we've heard in conversations with other people, and that is that we are an educational institution. A lot of what we do is training and teaching. We haven't heard much in the presentation today about where students from University of Michigan fits into the center, where training and of our partners global partners might fit into the center. So training and education broadly beyond just research, does it fit into the center? Where and how? And I don't know who wants to take that question. I guess John or Joe.
Maybe I'll start and hand it off. First of all, I'm the education dean for the medical school, and that's my day job, and I care desperately about that. What often has happened in global health, though, is that the connections exist only because of transient learners. And especially medical communities have been famous for this. We collect the tuition here, we send our medical students out to other settings to be trained, and none of that tuition follows them. And low-income countries are tired of seeing all these learners without more of a connection to what's being built, or what one of our other questioners had mentioned, working ourselves out of a job. So one of our first approaches or tactics here is to create a stickiness between faculty. Faculty don't turn over every 3 to 4 years. And so we want to have that as a firm connection to create the environment where learners can get the best education. Also, one of the things we're trying to be focused on is impact. How are people going to live differently? And we want our faculty to be leading and showing our learners, of course, learning from our learners, but showing how many more people have been turned on to global health is going to be great. But showing what they are doing in terms of global health and making people like me obsolete is going to be better. So that's how we're trying to balance and remain very committed to our education mission.
Laura.
If I could just point out, I've been really kind of pleased to have so many students that I've been able to place in different parts of the world. And Andreas, because I think you gave me my group some money to send a few students to Ethiopia one year, which has been wonderful. But I think students will benefit from strong, long-lasting partnerships, which is how the students have worked really well in the context that I've had, where they've been able to move into projects. And in fact, just today, I had an impromptu kind of mentoring session with some SPH students, orienting them to the resources available on campus. And there are a lot. In the School of Public Health, we can fund internships. As you know, the International Institute has money, and there's several places that students can go where they can get funding to do an internship, do a global project. But I think they'll really benefit from strong, long-lasting partnerships that we're able to build in the different communities from mGlobe.
Thank you.
I think data science also, just to add one sentence, is that the NIH funding opportunity announcement, the training and education is one of those pillars, and where US education institutions can take a lead, and Michigan has been known for these programs. And again, I like to underscore Laura's point that we want to build capacity and exchange and traveling scholars. So this is very integrative process, and that's the model that we are putting forward as a part of that proposal as well.
So I just learned that indeed the questions will all be saved. So I'm sure that follow-up will be possible afterwards as necessary, if a question needs to be addressed, because we only have about 10 minutes left, but please keep on adding your questions. At this moment, I'm selecting and trying to combine some of them so that we can address more of the specific topics. So here is another broad question. So the center is intended to be really between schools across the whole university and between the 3 different campuses. How is that going to be structurally ensured that it doesn't become dominated by the medical school and the School of Public Health, or by the Ann Arbor campus exclusively? I mean, is this built into the structure of the center to ensure that it does this, or is this just, words leaving our mouths?
Maybe I'll start on that. first of all, our executive committee is made up, it's co-led by Susan Collins, the provost, and then Marshall Runge in his role as executive vice president. So there are 12 different deans that serve on that. Our advisory committee has been made up from members of all schools. We had one advisory committee, and we went into a little bit of a shutdown with COVID-19, so we're kind of rebuilding and redesigning transitions in the provost's office as well, so we've had to reshuffle some things. But John and I, we've been to 3 campuses, bringing in people who are, so I think we need to stay extremely engaged and accountable to our executive committee, to our advisory committee. We're also going to be designing an external advisory committee with stakeholders that we're aiming to serve. But and I can tell you it's the highest priority for our donor to say, you know, Michigan has got a lot of good people. They don't always play together to bring out their mutual strengths. He's got a pretty sharp eye on this that is going to want to see evidence of that happening.
Thank you. So I see a couple of questions that kind of ask about areas of focus, right? And acknowledgement that a lot of collapsing and focus had to happen to come up with these 3 challenge groups. And, but I see questions of people asking, infectious diseases is a big theme in global health. We don't see it present here. Or COVID-19 taught us that pandemics happen and really disrupt health systems. Should pandemic management be a theme? So I guess, some kind of question about how do we add new themes to the center beyond these initial 3, or, is there room for more?
I guess I would say infectious diseases heavily in climate and public health. A lot of the work that I think is ongoing now is in infectious disease. So, and I do agree that there's a need to go beyond that. In fact, if you look at some of the initiatives going beyond infectious disease to chemical-based or other types of hazards that are increasingly important in low-income countries is also important. But yes, I just want to point that out. Yeah.
Mm-hmm. So it's not very visible in the 3.
I get it. Yeah.
That we've mentioned, right? But so the idea is it's in there. It might not be visible, but maybe it should be more visible. Laura, sorry, I interrupted you.
I just, I'm working on some COVID-19 international work right now. And if there's anything more humbling to the Western world than COVID-19, I don't know what it can be, that has taught us that the countries that are doing this the best are not the Western countries, are countries that have functioning health systems, like Thailand, countries like Mongolia that have a system of community health workers and the ability to shut down borders. I mean, these women community health workers have been tireless in a lot of the low-income countries in COVID planning. So just using a little imagination and thinking about how things like infectious disease and work through these 3 themes, and of course, with data, I mean, Bhramar has been the best example of how we can get data from some of these countries that have been able to collect it in a very meaningful way. So I think, if anything, a nice examination of what other countries can teach us would be, with COVID-19, would be really relevant and helpful.
And I just like to...
Sorry, one second, maybe throw it to you, Joe, the part of the question of how would one go about if you want to add another focus to the center beyond these 3?
Yeah, we would be delighted. First of all, we got to the 4 themes through listening to our faculty and picking up on who's got energy to pursue this. So we were very much, this isn't something we cooked up in a dark room somewhere. We're out there talking to our faculty and saying, what would you like to engage with and what would you like to work with others on? So this is what brought us to our themes. The challenge groups have been collection of energy, and we would be happy to hear proposals or ideas to say, how about if we started to gather faculty from other schools around this idea. But again, remember John's lens in terms of this has got to bring faculty together across schools. There's so much to do in global health. You know, we haven't talked about nutrition and starvation or obesity or tobacco, the chronic disease movement. But what we're trying to do is capitalize on where's the energy of our faculty and where would they like to work differently and collaboratively on others to try and make impact. So bring it on. I mean, this is one of the purposes of these conversations, to try and get the faculty pulling together in a common direction.
We have about 4 minutes remaining for our Q&A period. So I want to go back to a higher level question, which showed up in our Q&A, I think asked by several people in some form, but most clearly by Cheryl Moyer, which is, overall, what do we think this center needs to be if it's going to be successful? So, we have this initial infusion of funding from a donor. If that funding is to continue, what do we have to do? What does success look like in 5 years, 10 years, 30 years for the center? John, or Joe, I mean, that's kind of your bailiwick.
Sure, Andries. I think that's a crucially important question. And we really want our community, the people participating in the webinar and our global partners. And I think we definitely hope, while we're starting, this is the first of many programs that we'll have, and it's focused on our campus community and our university community this time. But I expect, in future webinars, we'll be bringing global partners into the conversation. We want all of you helping us to define that success, because it's really the success of our university and global partners that will define the success of the center. Within these themes, what we really are looking for is collaboration that wouldn't happen without the center, and this line of sight, as we said earlier, to impact. And so I think in each of the projects or challenge groups or initiatives that are supported through the center, we'll be looking for the Michigan and global partners to define what those measures of impact are, and and that will be an important part of deciding where the resources of the university are focused. But we also want to be nimble. We want to be open to opportunity, as we mentioned earlier, to disruptive innovation. So it's very much in an early stage of the process here, and there's lots of opportunity for people to be involved in setting and implementing the agenda, both at the university and among our partners. And we hope all of you within our university community will help us to engage with the partners as effectively as possible, whether they're existing partners where we already have collaboration or new ones that we're looking to develop.
Maybe I'll channel for a moment our donor. He's a high net worth guy. He signed this compact that was started by Warren Buffett and Bill Gates, that high net worth people shouldn't leave all their money to their kids. They should leave most of it to society. So he signed that, and he's very much part of that movement. At least what he explains to me, and he's part of academia, and he says, for global health, for philanthropy, a lot of times people can't see the connection to how people are going to live differently. They get the ivory tower polishing and the currency of the realm. We write our papers, we get our grants, we kind of move things forward, but we're not that good as to telling the story. Therefore, this is how people are going to live differently. That's how we're enabling people to do better. It's a missing part of our narrative. If you look at any of the global health centers, everyone talks about impact, but it's often impact on ourselves in our rankings and our competition that we do amongst each other. But we're not that good at telling the story of how do people live differently because of this. So I would say success, 5 or 10 years, we're changing the narrative where we are collaborating differently and telling a story of impact and enabling that makes people like us obsolete. so that people in low-income countries, in other words, when they're looking for partners, or when there's this RFA that needs to be centered in Africa and they're looking for a group of faculty to enable them and advance them on what they want to do, they say Michigan. I think if we start to show, if we talk differently, when we start to show more of that evidence, our donor is pretty convinced that there's going to be other high net worth individuals that come in and they want to invest in a different model. And so none of us are naive. We're not going to go out there and cure malaria in 5 years or things like that. But even just changing our language, not just how many people we've trained or how many people we've turned on, but how rarely we talk about how people are going to live differently or benefit from our work in academia. I think we suffer from that in academia in general, but particularly in our relationships in low-income areas. So I think that's how we're going to define success, is how we proceed there. And of course, the currency of the realm, of course we want to write papers, we want to get grants, but we want to show a connection to how our efforts are impacting lives and enabling and empowering people who haven't had the equity and the advantages that so many of us have had here.
Thank you. So we have reached the end of the time allotted for Q&A, and there's many questions we didn't get to. As I've said, will be saved and follow-up will happen as necessary. So thank you, Laura, Bhramar, Nancy, John, Joe, for the Q&A. And Joe, I think it's back over to you for closing words.
Just a couple of minutes. Thanks, Andries, for leading the discussion. I'm really inspired by the comments, and we are going to address these and put those in a way that we can get back to people and build the conversation. And I hope that's how you interpret this, is our efforts to very much build conversation. So where do we go from here? Where we're going to have monthly seminars like this, where we're trying to build community and get people attached to designing specific ideas. In the meantime, know that we've come out this week with our website. I have to say it's in its humble beginnings, but when people are trying to understand a little bit about the background, or our efforts to try and get people connected with John's leadership and others, we're really going to make it easier for faculty to find each other. One of the things we suffer from institutionally, sometimes when there's an opportunity out there that requires a multi-dimensional approach, we're not that quick at fielding a team or providing the kind of support people need to make something happen. So we're going to be building community very much around this website. Know that we've got a growing staff as we get connected. Tanya Piotrowski, who has also been in Global Reach. Christina Rice, who we thank for weaving together much of tonight's presentation, a project manager. I'm really delighted with a new member of our team who starts next week, Christabel Sefa. Christabel comes with almost 10 years of experience with World Bank. So as you know, for efforts like this, we need to be reaching out to all the multi-sectorial arenas. So we're going to be building staff, but know that we anticipate most of that funding is going to be going for faculty projects. And again, we're not limited like we are with NIH and other grants in terms of how much money we can send overseas. We've got to be sharing our resources with our partners and the people that we want to work with. So two of my favorite quotes. One is the Zulu term, Ubuntu, I am because we are. We're trying to create relationships, and that African proverb, if you want to go fast, go alone. If you want to go far, go together. We're in the early stages. We're trying to put this together as we go along. So for anyone who thinks the train has left the station, that's not true. But we wanted to give people at least a sense of our current thinking right now so that they can figure out by example what we're working on and try and influence other ideas and collaborations. So, so thank you. We'll be following up by email. Again, our next seminar is a month from now where we're going deep on data science and global health initiatives. Again, part of this $60 million initiative from NIH. A lot of people are talking about data science for global health. How can we engage there? A special thanks to our panelists and to everyone who's helped bring out this webinar. So with that, I'll wish you a good evening and look forward to future conversations.